Making a behavior easier to perform increases gym frequency. The behavior this lab report will focus on will be the number of times the participant goes to the gym in 1 week. This will be done by the participant who will self-monitor the behavior. Physical exercise is an important part of physical health, mental health, and well-being, according to the Australian Department of Health and Aged Care. However, only 50% of adults meet the required physical guidelines. Laforge suggests that people who did not have a gym routine were more likely to have poorer physical health and quality of life. Furthermore, participants who regularly went to the gym reported an optimized self, more productivity, more control over their lives, and an increased psychological resilience. Therefore, regular exercise, such as the gym, appears to be important for both physical health and mental health. The targeted behavior that will be changed is the number of times the participant goes to the gym within a week. A baseline will be measured for a week, then an intervention will be implemented and measured the next week. The aim the participant had decided on was to go to the gym more frequently. In measurable terms, the participant's goal was to go 4 times per week. The intervention decided on was making behavior easier to perform. The point of making a behavior easier to complete is to increase the perceived behavioral control. Perceived behavioral control is a part of the planned behavior theory. Simply put, it means how much an individual believes a behavior is in their control. Therefore, an increased perceived behavioral control means someone is more likely to engage in that behavior. To increase perceived behavioral control and make the participant more likely to go to the gym, an alarm was set each day as a reminder, and preparations of a gym bag in the morning beforehand was also done. Reminders such as the participant's alarm have been shown to strongly increase frequency of those going to the gym. In other words, increasing the perceived behavioral control. The participant who was being assessed was 21 years old, a male who was currently studying at La Trobe University. It's worth noting that the participant has a current diagnosis of Crohn's disease. The materials used at baseline was a self-monitoring sheet. The sheet consisted of the day, a yes or no if the participant went to the gym, the time the participant went to the gym, and additional comments. After the baseline was recorded, the intervention was implemented. As a part of the intervention week, the same self-monitoring sheet was used. Furthermore, an alarm was used each day along with an organized gym bag that had a change of clothes, water bottle, and hygiene products. The participant was instructed to complete the self-monitoring sheet over the baseline period for a week. The participant was told to fill out the sheet right after going to the gym, as it would leave minimal chance for error in the measurements. If the participant did not go to the gym, they were required to fill out the sheet before bed. It was instructed to continue with a regular routine and try not to change anything despite the self-monitoring. During the intervention phase, completion of the self-monitoring sheet was the same as baseline. However, the participant was required to set a daily alarm for 10 a.m. as a part of the intervention phase. Furthermore, each day, the participant had to organize a gym bag in the mornings. This way, the participant had a reminder to leave the gym at 10 a.m. and was also well organized before going. As seen in graph 1, during the baseline week, the participant went 2 times. Once the intervention was implemented that week, the frequency went to 4. Therefore, the frequency to go to the gym doubled from 2 to 4. Furthermore, as seen in Table 1, the chance of going to the gym during the baseline was 29%. During the intervention week, the chance of going to the gym went up to 57%, a 28% increase from the baseline. The frequency to gym visits going from 2 to 4 confirms that the participant met the goal of going to the gym 4 times per week. Self-monitoring was a very quick and easy way to gather data for baseline week and intervention week. It also allowed the participant to better understand the behavior they monitored, creating awareness and curiosity. A barrier the participant ran into was the self-awareness of how many times they went to the gym during the intervention week. Once the participant had realized they went 4 times, they stopped the behavior midweek. This meant without the self-monitoring sheet, the participant could have potentially gone more days. Self-monitoring is an intervention. This became a limitation during the baseline week. The participant was more self-aware of the behavior of going to the gym, therefore potentially increasing the frequency of gym visits during baseline. The modification of the behavior to reach the participant's goal was a success. The participant managed to go to the gym 4 times during the intervention week. The intervention implemented was easy to complete, straightforward, and effective. Furthermore, creating an achievable goal is less physically demanding and psychologically allows the participant to believe achieving the goal is possible. However, the participant reported that due to their Crohn's disease, they were unable to go to the gym some days. This affects the outcome of the results. Potentially in a healthy participant, frequency would be higher and more consistent as there are less factors in the way. A study done by Cazzolari states that participants who receive simple reminders via emails strongly increase gym attendance compared to those who do not receive reminders. Unfortunately, no study has been directly done on organizing a gym bag to increase perceived behavioral control. However, a systematic review by RAND explored 14 papers reporting 20 interventions for the gym. Interventions include reminders, goal setting, and an organized structure for the gym. It was found that these interventions had minimal effect on the gym frequency. The current lab report does not support Norman's results as they found minimal correlation. It does, however, support Casalori's results. The current study made the behavior easier to perform. This was probably due to increasing the participants' perceived behavioral control via the gym bag and alarm. Overall, only a small number of papers have been published on testing interventions to increase gym attendance. Further research is required in this area. Based on previous literature, the use of interventions may increase gym frequency. This current study focused on one individual completing a baseline week and then an intervention week. It was found that making a behavior easier to perform increased the frequency from 2 times per week to 4 times per week. This supports the idea that making a behavior easier to perform, such as a reminder and a pre-packed gym bag, increase attendance to the gym.